Good evening, everyone, and welcome to tonight's live telephone town hall with Congresswoman Rosa DeLauro, your representative for the 3rd District of Connecticut. My name is Robin, and I'll be moderating the conversation this evening. In a few moments, we'll be joined by the Congresswoman, but before we begin, I'd like to explain what will happen in the next 60 minutes. The purpose of this call is to provide an update on health care coverage ahead of Medicare and ACA, Affordable Care Act, open enrollment. We'll be joined by Judy Stein of the Center for Medicare Advocacy and Susan Rich-By from Access Health, Connecticut. This is an interactive forum, and we'd love to hear from you this evening. We'll be asking poll questions this evening so that we can hear from everyone in the audience. If you're on your phone, you can vote by pressing the corresponding number on your telephone keypad. If you happen to be online, you can vote by selecting your response below your streaming player. If at any point in tonight's call you would like to ask Congresswoman DeLauro a question, simply press *3 on your telephone keypad. Again, that's *3 on your telephone keypad now or at any time during the call. You will continue to hear the town hall until one of the Congresswoman's staff members can assist you. Once you are connected with a staff member, he or she will note your name, the town that you're calling from, and your question. And if you hear your name again, it will be me inviting you to direct your question to Congresswoman DeLauro. Again, *3 to ask the Congresswoman a question, *6 if you'd like to subscribe to her newsletter. You may also subscribe online at delauro.house.gov. And if you're streaming the event on our website, simply type your name and your question below the streaming player. To make sure we hear from as many people as possible this evening, we ask that you keep your questions brief and to the point. If you don't have a chance to ask your questions during tonight's telephone call, please note that you'll be able to leave a voicemail for the Congresswoman and her staff at the end of the call simply by remaining on the line. And now, without further ado, I'd like to welcome Congresswoman DeLauro to the call. Thank you, Congresswoman. The floor is yours, and please go ahead, ma'am.
Oh, well, no, thank you so much, and I'm so delighted, Arvin, for the moderating this evening's event, and I want to thank everyone out there who's joined tonight's call. Again, this is Rosa DeLauro. I represent Connecticut's 3rd Congressional District. And I will repeat, if you would like to ask a question tonight, please press *3 at any time. This places you in a queue to speak to a member of my staff. Tonight, I'm here to listen. Listen to your questions about President Trump's cuts to health care and how that will affect the premiums you pay for insurance plans through Access Health Connecticut. Open enrollment starts November 1st. Medicare open enrollment is already underway. So we are also here to answer any questions you might have about the differences between traditional Medicare and Medicare Advantage. Before we get started, I'd like to say a few words and then introduce our guests who will be helping answer your questions tonight. Americans are in a cost of living crisis today. Families live paycheck to paycheck. They face the costs of groceries, of housing, of electricity, and chief among, and at the top of that list of costs that they can't cope with are health care costs. They are a burden for so many families. President Trump is making it worse. He and his Republican allies in the Congress are allowing the Affordable Care Act tax credits to expire, which have helped millions of Americans who purchase health plans from state health care exchanges like Access Health Connecticut, including 143,000 Connecticut residents. Thanks to President Trump's health care tax hike, premiums could rise dramatically, and people are receiving those notifications this week. And I would ask you, if you have received one, please let us know on this call, because your stories will help me to fight for these subsidies in Washington, D.C. Senate and House Republicans have shut down the government rather than address this problem. I am and Democratic leaders are fighting to extend the current tax cuts before December 15th, which is when people must pay their premiums to be covered in the new year. If there is one thing you can take away today, it should be this. Shop around. Look at all of your options. Take advantage of the local resources, including the organizations on this call. The big, beautiful bill triggers a $500 billion cut to Medicare, which would mean that the federal government may have to reduce payments to hospitals, to physicians, and other providers, which could lead to providers offering fewer services or simply no longer accepting Medicare coverage. Their priorities could not be clearer, which is why I am demanding that they come to the table, negotiate to reopen the government, come to a bipartisan agreement where we can lower the costs, cancel the cuts that are being talked about with Medicaid and the Affordable Care Act tax credits, and save health care. I'm not going to stop fighting for affordable health care for you or for your families. I deal with a lot of issues: roads, bridges, helicopters, jet engines, etc. But none more important. Health care, the result of curtailing or stopping or making it impossible for people to afford their health care, leads people to die. So this is about saving lives, and that is what health care and treatments coming from health care allow us to do. Now I would like to introduce my guest for the evening. I'm grateful to be joined by Susan Rich-Bai, the Director of Legal and Government Affairs for Access Health Connecticut. Susan has been helping sound the alarm on President Trump's health care crisis and can tell you more about how Access Health Connecticut is approaching this enrollment season. I'm also joined by Judy Stein, founder of the Center for Medicare Advocacy, which is located right here in Connecticut. Judy is a champion for Medicare, and the Center for Medicare Advocacy has become a crucial source of information and legal services in the healthcare policy arena. I might just tell the audience, the three of us were together just about a week ago, dealing with another part of the state and talking about these issues. It's our intent to get around to the whole state so people can understand what is going on. Thank you both for joining me today. Now we want to hear from all of you. Press *3 to ask a question, and my team will connect you.
Thank you. Congresswoman, are you ready for your first question, ma'am?
Absolutely. Let's go.
Okay, we've got a question from Christopher. He submitted his question online, and Christopher says or asks, what is the estimated changes, or what are the estimated changes by percent for healthcare if we lose subsidies? And Christopher says, thank you.
Okay, I am going to, I'll add some things to it. I want to get to Susan to really go down the line and answer that question for you.
Thank you very much, Congresswoman, and thank you for this question. So the changes are, and I do want to note, the original ACA subsidies, the tax credits, will still be in place regardless of what happened with these enhanced tax credits that we've been talking about. So in 2021, a different structure went into place under the American Rescue Plan Act, and it's been continued through the Inflation Reduction Act through this year, that provides richer subsidies. So it made the amount that consumers have to contribute toward their health insurance smaller, made the subsidies larger, and then it also removed the cap that had been in place under the ACA at 400% of the federal poverty level, which we all know is not high income. That is still very moderate income, certainly in a state like Connecticut. So if these enhanced tax credits go away, consumers with income over 400% will no longer be eligible for any financial assistance, and those under 400% will have to pay more towards their health insurance, and it goes up on a sliding scale depending on the income. I hope that's helpful.
It's helpful, and I would just add this, and you tell me, Susan, this is accurate. In other words, that 400% of poverty, if you and it depends on household and family size. So if you're at 400%, you have family size of 1, that's $62,600 a year. If you're 2 people, it's $84,600. If it's 3, you get 106, and so it goes up depending on your house and your family size is your eligibility there. I also want to indicate that the average monthly change, an increase in premium. If you are from 0 to 100% of the federal poverty level, which is around $15,650, your increase would be about a little over $1,400. That's the increased premium, and that is a per month charge. If you're between 100 and 200 percent, that is, and I'm going to go with the family size of 1, if you will, 31,300. It's $99.14. That's the increased premium, and it's per month. 200 to 300% of federal poverty, which is almost $47,000. It's $170 increased premium per month. And 400 plus, as we talked about, is it could be $825. So overall, when you look at this, we could be looking at, the total number about $2,700 in terms of increased premium costs, depending on where you are in terms of the federal poverty level. I just want to check with you. I believe that's the information we have from Access Health. Susan, tell me if that's accurate, if I've talked about that accurately.
Yes, you have. Thank you. And those are averages, and it really depends. And in addition to the amount of subsidy, depending on your household, where you fall on the federal poverty level, which is based on your income and your household size, how many people in your household. The other factor that comes into play is age and where you live in the state. Connecticut uses 2 rating factors for the premiums, the actual insurance premiums. So depending on the county, certain counties have higher health care costs in the county, so the premium is higher in those counties. And then it goes up, obviously, by age. As people get older, they utilize more services. So for a couple of 2 people that are in their 60s, their monthly premium is going to be a lot more than a couple who are in their 20s or 30s. So as Congresswoman DeLauro pointed out, for those over 400% of the federal poverty level who could lose all eligibility for their subsidies, if people are at that, are at an older range, the premium impact is going to be really, really significant because the premiums are going to be higher due to their age and possibly their county.
Thank you, ladies. Next caller is Ann from Beacon Falls. Ann, you are live on the call with Congresswoman DeLauro. Please go ahead, Ann.
Hi, thank you so much for taking my call. I am so anxiety-ridden with what's available from Medicare. I don't qualify for Medicaid. My husband and I are on fixed Social Security income. That's it. And I have been to seminars. I have been with agents trying to find an affordable plan that covers our needs. Because I got a notice from I've only been on Medicare for a year, and I've got a letter saying that Anthem is leaving Connecticut with their premium plans, and so is United Healthcare. So I'm searching for affordable healthcare coverage for my husband and I, and unless I come up with $1,000 a month on Social Security income for Medigap, I don't have a plan. And it's like, how do I politely say this? It's a gamble for the plan that I take, which I've been on for a year and I'm not happy with. And I need you to open the government and have this conversation for regular seniors, not poverty, just regular seniors. I need your help in getting me a health care plan, and I'm not poverty stricken. I'm just Social Security stricken. How am I going to get help for my needs?
Well, listen, first of all, thank you, for the comment and for the question. I'm going to ask Judy to talk about Medicare, and I'm going to ask her to talk about what the cuts and the reason why there will be cuts to Medicare to the tune of $500 billion over the next 10 years in cuts to Medicare, and then see if we can try to provide you with some advice about what the direction to go in. The government shutdown surrounds the issue of the $1 trillion cut to Medicaid, and you don't qualify that, but Medicaid affects children, the disabled, low-wage workers, and seniors, and that's an area. But now Judy, why don't you take it away and talk about the Medicare and the $500 billion cuts and how we can help our friend here on the phone.
Yes, let me start with suggestions for you to get some assistance in making some decisions about Medicare for 2026. First, as I've indicated to Rosa, Representative DeLauro and her staff, we are concerned because we do not know what the Medicare copay rates will be for 2026. So there's another wrinkle in making it harder to make choices for the coming year, because we usually will soon, if not already, know what the deductible coinsurance and copays will be for Medicare. We don't have that information yet, but there is help available for people just particularly in your situation, which is not unlike mine, and that is in need of determining what kind of Medicare would be best for you for the coming calendar year. And I think that from what you tell me, if your Medicare Advantage plan hasn't served you well, it would be very good if you could get some help to see whether you could make a change to another Medicare Advantage plan that would meet your needs, or be able to join traditional Medicare with a Medigap and a Part D prescription drug plan. The way to get help to do that is to call our partner program that the Center for Medicare Advocacy, my organization, partners with all the time. It's called Choices, and if you call them at 800-994-9422, they are there ready and particularly able and required to give you independent, objective advice as to what would best serve your needs. And I always say you need to consider three things when making a decision about Medicare, which is your health insurance. And that's one, no offense to any of us, but we will get sick. People are human beings get sick. So number one, you will get sick. Number two, you might get injured. And number three, what can you afford? So you want to see what is the best choice for you, traditional Medicare with a Medigap and a Part D prescription drug plan, or perhaps a private insurance company Medicare Advantage plan. What will best cover your drugs, cover what you need if you get ill, or if, God forbid, you get very ill or injured, and will your preferred physicians and healthcare providers and healthcare facilities be available to you if you do choose a Medicare Advantage plan, which will be more limited in terms of what providers you can see. So I suspect there are answers for you that choices could help guide you through. And again, I want to give you that number. It's 1-800-994-9422. And between now and December 7th, the Medicare annual open enrollment period is ongoing right now. So it's time to make an informed decision about what you need for the coming year. And I recommend strongly that you call Choices at that number, 994-9422, as soon as possible, because they get very busy. And right now they're still operating, but with the shutdown, we can't be sure. So I hope that's helpful. There is help for you to make these decisions, and I hope that you can find something that will serve you well for the coming year.
Let me just
Thank you so much.
No, thank you.
Please go ahead, Congressman. Yes.
Let me just reinforce, please call that number. Pick up the phone and do it, because you can get help and what the issue is, and you can help. People can guide you through this complicated process, but there is help out there.
Yes. And there may even be help, depending on your income, could be middle to moderate income. There might even be help for helping to pay with those co-insurances. So do call Choices at that number as soon as you can.
Thank you, Judy, and thank you, Congresswoman. Folks, if you happen to be joining the call a little late, this is an interactive forum this evening. We would love to hear from you. If you would like to ask the Congresswoman a question, press *3 on your telephone keypad. And if you're on the line and you're enjoying this update and you want to stay informed, you can subscribe to the Congresswoman's e-newsletter by pressing *6. Our next question, Congresswoman, comes from Reshma of New Haven. Reshma, you are live on the call with the Congresswoman. Please go ahead, Reshma.
Hi there. My name is Reshma Ramachandran. I'm a primary care physician at a federally qualified health center in New Haven, a resident of New Haven, and I'm also a professor at Yale School of Medicine that looks at access and affordability to prescription drugs. I have a question because, I'm seeing a lot of patients coming in with their notices about premium increases and a lot of questions happening. I'm also seeing a lot of rhetoric coming from mostly Republicans on the other side talking about how the expiring ACA subsidies have nothing to do with increases or any sort of changes to employer-sponsored insurance, which we know from research and we know just from practice is just not true. I'm just curious in terms of what the plan is to kind of articulate to the public about how all of these sorts of changes in health that are very seismic, loss of Medicaid insurance, the impacts of the ACA subsidies expiring on employer-sponsored insurance and the rise in premiums that we're going to see across different plans, Medicare Advantage plans leaving Connecticut, how all of that is kind of interconnected and what's happening right now really needs to be addressed immediately, and if there needs to be negotiations to open the government back. This sort of misinformation is something I'm dealing with a lot in my clinical practice, and I'm curious about kind of the message from the Democrats and other folks on the health advocacy side to kind of set the record straight about all these changes.
Yeah, no, and that's why we're here tonight, is to set the record straight. And, and people can check what I'm saying. They can, check what Judy and what Susan are talking about and come to their own conclusions about that. There is so much fear and uncertainty out there, and there is an interconnection. We are looking at the cuts to Medicaid, which is $1 trillion. That was in the big, beautiful bill. $1 trillion in cuts. That is 143,000 people in Connecticut, they lose their health care. Now, you're in a community health center. Community health centers provide primary care for over, 25 million people in this country. There is great concern about what happens if people are jettisoned from Medicaid. That affects the community health centers to the point at which they may need to close. I've met with folks in the disability community just a few days ago, and that's a community in which, and you got a number of of families with children who rely on Medicaid. Medicaid is a lifeline for their families. Now, if they can't afford the insurance, they will drop the insurance. But when they get sick, they get treated. So the interconnection there is uncompensated care, because if you go to the emergency room, you go to a hospital and you get treated, that then you someone has to pay for that. And it is I think I read, and if you just bear with me for a second, just read an article this afternoon that says, with regard to uncompensated care, first of all, Connecticut hospitals are projected. This is not anecdotal. I'm giving you information. Connecticut hospitals are projected to lose $22 million in revenue when the tax credits expire. That is according to an analysis by the Robert Wood Johnson Foundation. The amount hospitals spend on uncompensated care is also expected to rise by $5 million. People are going to choose to go without insurance because they can't afford it. They'll go off the exchange, but they'll get sick. And they're going to doctors, and they're going to hospitals. You've got about 52,000 Connecticut residents could lose coverage if AIDS ends. 130,000 may see reduced help. So this is the interconnection. It's all tied in. This is about the big concern, which is at the crux of the battle, if you will, in Washington today, is that right now, since the letters have gone out, premiums are increasing. People are getting those notices already, and that's happening all over the country. And then the cuts are there, but those cuts, because they designed it, to be very honest with you, they designed the cuts to go into effect on Medicaid after next year's election. So, but the immediacy is the premium subsidies, and that has to be dealt with now. And this continuing resolution that is being discussed deals with health issues. They may want to tell you that it doesn't, but it does. It's 91 pages long. 67 of those pages deal with health issues. So this is an appropriate discussion before we move forward and we see these credits expire, and that people are going to be without health insurance. I have to make one more comment to you, because one of the lies, quite frankly, that has been told around this is that and it's what Democrats are about, is that we are looking for $1.7 billion in order to provide health care for illegal immigrants. That is a lie. We ask the questions, and Access Health can buttress this up. Are undocumented immigrants eligible to purchase health insurance through Access Health Connecticut and other states' ACA marketplaces? The answer is no. No. It is not the case. So don't let them pull the wool over your eyes to say that this is where it's going. This is going to your friends, for your neighbors, for your families that are going to be left in a situation without being able to have access to health insurance to take care of their health care needs. I ask either Susan or Judy if you want to say anything else.
I would just add that this...
Go ahead.
Sorry. I would just add that everything that was said is correct. You can't look at one type of coverage in a vacuum versus another. They all impact each other. The provider rates, as you know, all impact each other. So all of this has an effect. So even if someone says, well, I'm not in that ACA marketplace, so it doesn't impact me, it does. Because it leads to, as the Congresswoman pointed out, it leads to people becoming uninsured and uncompensated care, and all of these different things, Medicaid provider rates, everything goes into the mix, and it all accounts for rising healthcare costs for everybody.
That's true, and I guess I would jump in just with this comment. By the same token, germs don't know any barriers between whether you're insured, not insured. Frankly, if you're an immigrant with papers or without, we all catch things from each other, and we're our community, and we all need health care. So whatever is your source of health care funding, it's in everyone's interest to keep that as accessible as possible for all human beings, so we all stay as healthy as possible.
Thank you, Congresswoman. Thank you, Judy. Thank you, Susan. Our next question, and we have multiple questions, same topic. So this is to represent a number of people that are asking the same question. The question is it true that SNAP funding will end November 1st if the shutdown hasn't ended? And what can we do now to prepare for the thousands of people depending on SNAP to get the food they need?
Right. The supplemental nutrition assistance program, food stamps, really 400,000 people in Connecticut receive SNAP benefits in 2024. It's about 11% of our population. The Secretary of Agriculture has said that SNAP is going to run out in 2 weeks. That would leave 42 million people without benefits. Let me just say this to you. In this big, beautiful bill, there is almost a $200 billion cut to nutrition assistance. I don't make it up. Take a look. $200 billion in cuts to this. And the USDA sent a letter on October 10th to regional SNAP directors directing them to stop work on November benefits. There is a SNAP contingency fund. We are waiting for that to be released. It's an estimated $6 billion in this fund, available to cover a portion of approximately $8 billion needed for November benefits. Now, what they're telling you at the federal level is that this cut in nutrition assistance, and let's leave it to the states to pick up the slack. The state of Connecticut they'll try to do something. For the WIC program, they put a portion of money aside, $300 million, to deal with what would be the Women, Infant, and Children program as a shortfall. But the SNAP benefits, quite honestly, right now, are currently up in the air for November. The shutdown hasn't caused this. What has caused this problem is almost $200 billion in the bill that has been cut from nutrition assistance, and the dollars that are going to go to the states to cover the people, and in our state, nearly 400,000 people in Connecticut who received the SNAP benefits in 2024. Doesn't have to do with the shutdown. This was a piece of legislation that the administration put forward, and I'm proud to say that all but one Democrat voted against it because of the harm to Medicaid and the harm to nutrition assistance. And in fact, and the last piece of this is in that bill is a $4.5 trillion tax cuts for the wealthiest individuals and the biggest corporations. Don't take my word. Go and look at it. Look it up, read it, and you'll find out what's in it.
Thank you, Congresswoman. Next question, our next caller is Mike from Orange. Mike, you're live on the call with the Congresswoman. Please go ahead, Mike.
Great. Thank you very much. I appreciate the opportunity. My question was a rather simple one, just trying to get a sense of the number of people in the state of Connecticut who are insured, not on Medicaid, who are on ACA accredited plans.
let me just give you, I'm going to ask my colleagues to address this. There were 751 people in Orange get their coverage from the exchange, including 521 people that receive subsidies. District-wide, the number of people on Access Health Connecticut is, and you can verify this, Susan, 34,732. 32,317 have subsidies. Okay, Susan, Judy?
Thank you. I don't have the chart in front of me with the exact breakdown by the districts, but I will tell you that right now we have about 157 or 158,000 people enrolled in the individual market through Access Health Connecticut. And then there is also the small group market, fully insured small group market, both on and off the exchange, is also part of the ACA marketplace, if you will. So I believe altogether between individual and small group, I think the latest estimates are about 224,000 people altogether, but we have close to 160,000 on the exchange right now. And then there is off-exchange individual, but that number has gotten quite small. So most of the enrollment in the individual market is on the exchange. And then in the small group market, most of the enrollment's actually off-exchange. We have a small enrollment on exchange and more of it off-exchange. But I think it's about 224,000 people altogether in both markets in the state.
Yes,
Thank you, ladies.
I don't know if it's responsive to or necessary, but there are about 750,000 people who rely on Medicare as their primary health insurance in Connecticut. That's about 20% of our population. They're, by and large, 65 years of age or older, or they have significant, very significant disabilities. That's how one qualifies. And then I think it's about 20% of them who are eligible because they're low income, very low income for both Medicaid and Medicare. So regrettably, you hear all this, and it's a very complex environment to know who's on what base, right, and who's on a number of bases when it comes to financing their health care. So fortunately, there are resources in Connecticut to help you know where you can look. And we try to interact between one another and make sure we can do the best we can to get services to you at the best affordable price possible. But the times are different right now. We are facing these major cuts and major immediate increases in the Affordable Care Act premiums that if you're on the ACA and you haven't gotten notice, unfortunately you may very soon. We've heard of people getting notices that their Anthem Medicare plan is no longer going to be available to them. Some of those notices have been sent incorrectly, so make sure if you or you know someone who you're helping has gotten a notice that their Part D Anthem plan is ending. Just double check that that's correct. And if anyone steers you into a Medicare Advantage plan when that wasn't the reason for your call, or they call you and you didn't ask them to call you, please be very cautious of those calls and don't give them any personal information. Call Choices at 800-994-9422. They're the objective, authorized entity ready to help you. They get no commission for doing so.
Thank you so very much for sharing that information. Next caller is Michael from Ansonia. Michael, you are live on the call with the Congresswoman. Please go ahead, Michael.
Hello, Rosa. This is Michael from Ansonia. The reason why I'm listening in is because, there's a lot of money on this big bill that's being taken away, but nobody really is saying, where is it really truly coming from? What's being taken out? Is it jobs? Is it computers? Is it medication? Is it, complete health care? And then there's other people that I know that you said before that, there's immigrants that are here that are not getting, subsidies and stuff like that, but that's not true. They truly are, because I know a few that are getting it. that are here illegally, and they're getting all these benefits while we're stuck with the bill. Like, shouldn't we be trying to work on that situation and trying to get that resolved, where maybe if you take one from somebody, you give it to an American that needs it, versus us flipping the bill for everybody else in the U.S.
Let me just say this to you, Michael. I don't know who you're listening to or where you're getting your information from, but please, I can send you, and we can get you the statute. There is no undocumented immigrants. They are not eligible to purchase health insurance through Access Health, through Husky, the Marketplace, the Affordable Care Act. It is not there. Every one of all the exchanges, and I can give you the citation and the statute numbers, and which you can go and look them up. Don't listen to misinformation. You can decide one way or another, but have the facts in front of you, Michael. All the exchanges must determine an applicant eligible to enroll in a qualified health plan, and they need to meet 3 eligibility criteria. They need to be a U.S. citizen or national of the United States, be a resident of the state through which the consumer wishes to enroll, and not incarcerated. Now, again, if you don't believe me, believe the information that is coming out of the law and etc. They are not eligible for financial assistance to purchase the health plans through Access Health Connecticut or other states' ACA marketplaces. There's real clarity about this, and I hate to say this to you, Michael, but they're selling you a bill of goods. Now, you can decide one way or another for yourself, but if I were you, I would get hold of the accurate information to make the determination on what you think and what you believe. I'll just give you one more piece of this. In 1986, Ronald Reagan said to hospitals in the United States, if someone is dying near death and you treat them, whomever it is, we will reimburse you for that cost. It's less than 1% of the cost of Medicaid. And Ronald Reagan introduced it in 1986, and it is now a part of the Republican continuing resolution. They have not eliminated. So I'm going to say it one more time, Michael. Get the facts, understand them, and then make your decisions based on that.
Thank you, Congresswoman. And folks, again, there's still time to ask a question of the Congresswoman. Press *3 on your telephone keypad. And if you would like to subscribe to her newsletter, please, at the end of the call, just stay on the line and you can leave your name and your email address. Congresswoman, next question comes from Angela of Hamden. Angela, you're live on the call with the Congresswoman. Please go ahead, Angela.
Well, thank you. I do have a question, but I'm happy I'm participating. I want to interject a couple things. I cringe like crazy when I hear the lies. Trump is just nothing but a liar, and I want to add to what you said. When 43 years of service with the Department of Social Services, undocumented people did not ever qualify for anything. If they had children born in the, Rosa knows this, but I wanted her audience to know, in case they have never visited the Department of Social Services. When it came to medical through 43 years, the most an undocumented person might ever receive is they may get emergency medical services only, but that was the limit. And as far as any benefits, if the undocumented had a child or more who resided, who was born in the country, the citizen may get some benefit, but it wasn't that much. It was always prorated based on the standard of the same income and asset guidelines that everyone else has to abide by. So he's just promoting all these laws to make it look like the Democrats just give away all our money, give all these people welfare. See, that's why we're broke. And he's turning around and building a goddamn ballroom. What does he need a ballroom for? Why does the taxpayers pay for a ballroom instead of medical so they can live?
Thank you. Thank you. Or $40 million that's going, $40 billion that's going to Argentina. We got people here who need help. But $40 billion is going to Argentina to bail them out.
Thank you, Congresswoman. We've got another caller. We've got Stacy from Wallingford. Stacy, please go ahead. You're live on the call with Congresswoman DeLauro. Please go ahead, Stacy.
Hi, thanks for taking my call. So my question, I guess it's able to be answered. So I am a person who uses the marketplace. I have a plan through the marketplace. I pay full premium for that because I no longer, since I got married, am eligible for subsidies. Fine, whatever it is, what it is. So I pay $653.39 a month just to make this whole thing clear. I just want to know, what are we projecting will be the increase? Because my little world, what I got going on is me and my husband are trying to build a family. We have to do IVF. That's expensive. This plan helps us in that regard. I work 2 jobs. He works his job a lot. You get the idea. What are we thinking about? Because on top of all of these other costs that I have in just living in general, which we can all agree, life is expensive to some degree, what are we projecting? Like, is my plan, because I was thinking of sticking with my plan, is this going to go up by like $300 or $500? Like, where are we going with this? Because like, I'm also not made of money, and this could really jeopardize like what I plan to do in my future.
No, it's a very, very good question, and thank you for participating tonight. Susan, let me throw this one to you, okay? Because you're looking.
Sure. I can't speak to exactly for your situation, but actually, if you can share your contact information with the Congresswoman's office, we can have someone reach out. But as we've been saying, the renewal letters are in the mail or going out in the mail, so you should be receiving it soon. So it will tell you exactly what your increase will be for next year. So because you are not eligible for a subsidy, that part of the equation is not figuring in for your cost, but unfortunately premiums go up each year because the healthcare costs go up each year, and there are, fairly high premium increases for 2026. But I will tell you, we do have a number of options available. We have 22 different plans from all 3 carriers. So it may or may not be your best option to stay in the same plan that you're in right now. So the best thing to do would be to talk to a broker to look at, your health needs. As you mentioned, you have specific health needs that you're looking at and your budget, and to look at the plans that are available. And maybe there's one that a different one that might not have as much of an increase, or a lower cost for 2026 for you than what you're in now, that would provide you with the coverage that you're looking for.
Let me just say this, Susan. Let me ask, so it helps. First of all, I'm going to give you my office number, and if you want to give us, your contact information, we'll get it passed on to Susan. My office number is 203-562-3718. But Susan, you mentioned that we should go to a broker. Help with that in terms of what should they do? How do they do that? And how does she do that? And can she talk to your office about this? I'm trying to deal with how people are, can be counseled during this time, which is very confusing and very difficult for them to go through.
No, I appreciate that further question. Absolutely. So there are over 800 certified brokers, independent certified brokers in the state of Connecticut. who work with consumers. And if you go to our website, accesshealthct.com, and I'm going to forget the exact spot, but if you look at the top, I think there might be a tab that says Get Help. And there is a way to, there will be a pull-down menu, and you can get to a way to look up brokers in your part of the state, in your area if you'd like. You can also call our call center, and they can help connect you with brokers, that you can work with. And they, are the best ones to advise you, to talk to you about the plans and your needs and your budget.
What's your number? Can they call you? Can they call Access Health?
They can, and if you give me a second, I don't remember our 800 number, but keep talking and I will come up with the 800 number. My apologies, and I'll give it to you. Sorry, hold on.
I think I'm happy to hear the question, because each case is very specific, and the range of the dollar amounts has to do with your income, your family size, etc., and so. That's why people need to go to where they can get good, solid advice. That is not going to be adulterated in any way, but what is going to be helpful in meeting your needs and your family's needs. And that's what we're going to try to provide you with information, but also, and that information includes where you can get help and information going forward. And I would ask you to do this. On our website, you could talk about, if you want to share your story, that's helpful to help me to be able to look at what is happening in our website, DeLauro.house.gov. How'd you do,
Thank you.
Susan?
I have the 800. Thank you. I have the 800 number for our call center. It's 855-805-4325. And the call center hours, I believe, are 8 a.m. to 7 p.m. Monday to Friday, and 9 to 3 on Saturdays. And like I said, you can also look on the website and you'll be able to find, a tool that will help you look for a broker in your area of the state.
Thanks so much, ladies. Thank you very much. Unfortunately, we are creeping up on the top of the hour. We have time for just one more question, Congresswoman. We have a question submitted from Deborah. Deborah submitted her question online. Her question is the Democratic caucus in the House planning to return to work as a show of principle during the shutdown, even if Speaker Johnson is not opening a session?
No, that's a very, very, very good question. The answer to that is yes. We are in Washington. I've been in Washington. I came home last night. I am going back. For the majority of the Democratic caucus is in Washington. We got Leader Jeffries has called people, to be there for our caucus meetings, etc. I participated yesterday in a hearing where we brought in people who are going to be impacted by these cuts, whether they be the Medicaid cuts or the premium cuts. A young mother talked about, her son and his disabilities and what happens. They're middle-income people. They will not be able to afford to continue his treatment. The people who are not there are my Republican colleagues. They are on vacation. They now have been gone for almost a month, for almost 4 weeks. They are not in Washington. And Speaker Johnson he said he doesn't have any intention to call them back at the moment. I was there. I'm back home in Connecticut today. I've been rounding about. It was in Wallingford and other places, and talking to groups by virtue of Zoom, etc. But I am going back, and my view has been let's come together. Let's sit at the table in a bipartisan way and hash out the differences. We can get this done. I have negotiated appropriations bills in the past and these resolutions, and I've worked closely with my Republican colleagues, the other side of the aisle, and when you come to a negotiation, you compromise. You don't get everything you want. You compromise and you come to a conclusion, then you move forward. That's the way this has historically been done. I have been a part of that process, and I said I would meet anytime, any place, anywhere. And that is the same thing that the Democratic leadership has said, including writing to the president just about 3 days ago, asking him to sit down at a meeting. Within 24 hours, he wrote back and he said no. So they need to come back. They need to, get off vacation and come back.
Thank you, Congresswoman. Unfortunately, folks, that's all the time that we have for questions this evening. Congresswoman DeLauro, thank you so very much. Judy Stein, thank you. Susan Rich-Bai, thank you, ma'am. And ladies and gentlemen, we appreciate the opportunity to speak directly with you and answer your questions this evening. If we weren't able to get to your questions, please contact us through our website, deloro.house.gov, or leave a voicemail after this event. We will host more of these events in the future to keep you informed on what we're working on and other important updates. With that, Congresswoman, I turn the call back to you for your closing remarks, ma'am.
Well, thank you very, very much, and thank you for moderating. And I too want to thank our guests who are so knowledgeable about what's happening, and they've given you phone numbers to which you can call, and I've given you my phone number. So whatever outlet you feel the most comfortable with, that you want to be in touch to get answers to your questions, please don't hesitate to do that. And it has been said, if your question didn't get answered, get to us, and we will get back to you and an answer. Please understand that I'm fighting these attacks on our healthcare system. This is about dismantling healthcare in the United States. And I urge all of you to keep making your voices heard. Public opposition and outrage matters. It has already forced them to step back on several fronts. The Congress is an institution that responds to external pressure, and you are that external pressure. We have real examples, and these have come out from the Kaiser Foundation and from Access Connecticut. Look, individual in their early 60s living in Hamden has an income of $28,000, now pays $29 a month. They're going to pay $131 a month in 2026. That's a $1,224 increase in cost per year. Married couple in their early 60s living in Naugatuck, an income of $86,900, now pays $601 a month, will pay $3,871 a month in 2026. That's $39,240 increase in cost per year. Who can afford that? No one can. A couple in their early 60s living in Wallingford with an income of $88,000 now pay $609 a month. They'll pay over $4,000 a month, which is a $41,000 plus increase in cost per year. Family of four living in Milford with an income of $130,000 now pays $921 a month. They'll pay $2,800 a month in 2026. That's over almost $23,000 increase. Family of four living in Branford has an income of $69,000. Now pays $151 a month. They'll pay $394 a month in 2026. That's almost $2,300 increase in cost per year. This is real, and it's happening now. That's why we need to deal with now. And I just leave with this. What I want to do is to lower the cost of living for people. These healthcare costs, they're already forcing families to become so economically insecure. So we need to lower the costs. We need to cut the cuts that they are trying to make, which would put people in harm's way. But it is all about saving health care for the American people. Thank you so much for being a part of this evening's conversation. Good night. I wish you a good night, and it's not, Friday yet, but tomorrow is, so have a good weekend, and I hope to hear from each of you soon. Thank you, and God bless. Good night.
Thank you.